We are live. Okay. Hi, everyone. Good evening. Welcome back to Chai Together. I am your host and founder, Pratibha Day. Today, you are tuning in for your cup of courage, hope, and imagination. And we are here with Dr. Avishkar Sabharwal.
That's correct.
How are you feeling?
I'm doing well. How are you?
I'm doing great. So we had already started talking a bit and that we're in the same state. So how does that feel? Do you feel like more of like a closer connection with the live? Like, how does it feel?
Yeah, it's an interesting feeling. This world is a very small place. I mean, that's how I feel.
Hmm.
Um,
Because your reaction was like, really? Where? Like, where in
yeah,
Jersey?
it's funny because um, we're connecting through the internet, and
Hmm.
it's very funny that you could be anywhere in the world, right? And then you're
Yeah.
just like next door. Well, not technically next door, but yeah,
Hmm.
still in the same state. And it's a different feeling. It's an interesting feeling. You kind of feel a connection there, which is kind of deeper than being online.
Hmm.
Just face to face is, I guess, different.
Oh, we didn't even know because, maybe we could have met at like a Monday. You wouldn't even know, like, I wouldn't even know who you are, if that were to
Right,
happen. Because Jersey has a few of those. So
right.
I just want to tell the viewers a bit about you, may I?
Sure.
Okay, cool. So Dr. Avishkar Sabharwal, MD, diploma in ABOM, diploma in ABLM, has trained in internal medicine both in India and the States, and is board certified in obesity medicine and lifestyle medicine. His focus area has always been lifestyle diseases, especially obesity. His experience in India made him profoundly interested in the effects of nutrition on health and disease. He researched metabolic syndrome, which is often the outcome of obesity, during his medical degree in India. Dr. Sabharwal is a member of the Obesity Medicine Association, where he has been actively involved in the Speakers Bureau Committee. He is also a member of the Lipid Association of India and has been a speaker at various webinars throughout the country, highlighting the importance of recognizing obesity and metabolic syndrome in cardiovascular health. So you can also join his group and community, which I have linked in the bio. So how do you feel reading all that about yourself? Do you feel like it's an obligation in our culture to like be a doctor? That's a lot.
It is, but at the same time, I think it's very close to my heart what I do because I've
Oh.
had personal experience with it, and so I'm very passionate about having a healthy lifestyle, which can be challenging at times, even for me. I have to confess,
Yeah.
but that's something that I think is very important. Um, I'm not discounting the medical part of it, the medicines that go with
Hmm.
the with the profession. I'm not at all saying that they're not important. I'm saying they are very important when they're needed. But
Hmm.
I think they cannot alone help you or help me or help anyone. It has to be, a combination of a healthy lifestyle. And if you need medications, of course.
I like that. So are you both, believing in like holistic, treatments and medicinal treatments when it comes to clinical?
Well, I believe in evidence based medicine.
Okay.
Let's put it like that. Whether it's holistic, whether it's clinical,
Hmm.
if there's good evidence behind it, I'm all for it. So I'm very open. I don't say that you should not do this because it's not the traditional medicine, but at the same time, I would say traditional medicine is evidence based. So
Mm.
what I practice is evidence based. So yeah, I mean, holistic is okay, but if you have good evidence, I'm all
Mhm.
for it.
So do you take medicines yourself personally?
For some things, yes.
Yeah. You don't have to say what. I just wanted to know.
No, I do. I mean,
Yeah.
I believe in
Yeah.
allopathy. I believe in the medicines. I
Yeah.
strongly believe that if you need medicines, you need medicines. There are no two ways about it.
Hmm.
I don't think that while nutrition and overall health is very important, but there are certain situations and certain limitations to these healthy lifestyle changes.
Hmm.
And at that time, you do need the help of medicines, and they work great.
Do you feel you're dependent on the medicine, or do you like, I don't know, personally what you have, because my dad, for example, I believe he takes about 20 because he's in our heart patient. So I feel like he's dependent on it, the fear of his life. Like if he doesn't take it, like he may pass. So do you feel like, clients can get so attached to that?
Well, I think I don't know if that's what you're trying to get at, is being addicted to medicine versus something else. But I don't think it's about, being addicted to a medicine. It's not like a narcotic, which is, something completely different, where you can get hooked onto a medicine and have physical withdrawal symptoms. But with other medications, for example, for your heart health, for say high blood pressure, for diabetes, there's very good data for these medications. So it's not about being hooked on them. It's about managing these conditions, with the help of these medications, so that you can have a healthier life.
Yeah.
That's what I would say.
Thanks. Yeah, no, my point isn't necessarily addictive, like the fear, the attachment of, okay, so his heart attack was about 20 years ago, but he's so dependent on these 20 different medications. But instead of, trying the opportunity to like detach yourself from one, see how you're feeling, you want to keep taking them. Do you feel like that's a fear-based like
No,
thinking?
that's
No.
evidence-based.
Thanks.
That's pure evidence, because we know how these medications work. And really, I'll give you an example. If somebody's taking medications for, say, high blood pressure, right?
Yeah.
And their blood pressure is very well controlled with the high blood pressure medications. When they come off of these medications, their blood pressure is going to shoot up again. It's not because they're addicted to these medications. It's just because that's the way the body is. That's why the blood pressure medications were started to begin with. So they're helping. Now, you can choose not to take the medications, but that's your choice. But that means that if you're not going to take those medications, you're at an increased risk of, say, strokes, heart attack, this and that, you name it. So, I mean, at the end of the day, taking or not taking a medication is your choice. But there is very strong evidence for these medications that they work.
Yeah, so I still loop around back to that you're dependent on it because by your choice.
Think so. I disagree.
That's my perspective. Like he's dependent on it, as in like my own father, as in, if he doesn't take it, he doesn't feel well. Like, so your body's depending on that is what I mean. It's depending on the medicine to make it feel better. That's my point.
I get your point. But I think at the end of the day, you have to decide what life means to you. Right? I mean, if it means, because I'll be very honest, we have good technology now to keep people alive, right? And so even if, say, somebody has, for example, has a heart attack, we have stents we can put in. We have good medications that can prevent further heart attacks. All right. So it really depends on what you want in your life, what gives you happiness. If somebody's okay with not taking medications and, whatever, let nature take its course, that's a different scenario. Again, like I said, it's a choice.
Yeah.
But as a physician, yes, I strongly believe in these medications because there is excellent data to support that they will prevent these things from happening.
Yes. And I'm going to move on from this because now you understand my point and I understand your point. Not to negate the fact that, everything we're saying is from our perspectives and it's all true. I believe so. But I want to ask you regarding, your own website, Decoding Obesity. Like, how did that come about? Like, what is the story behind that?
That's a very interesting story. So, I've suffered from obesity myself almost all my life. And when I was in India, I actually reached my highest weight when I was doing my residency in India.
Wow.
And I thought I got to change something about it. And throughout my life, honestly, nobody told me that this was actually a disease. I thought that this is something that I have to take care of myself. And that's still a very common perception. Having said that, I don't say that you don't have to take care of yourself. You do have to take care of yourself, but that's not always the solution. You may need something else. But anyway, so I changed my lifestyle around drastically, and it helped me lose my weight that I needed to get rid of. And I got very interested in obesity, and I was like, okay, let me see if there's something out there about the science of this. What's the data behind this? Is it just eat less, move more, or is there something more to it? Honestly, I did not know that there was a specialty called obesity medicine at that time.
Wow, me
And
either. You're the first person I came across who specializes in it.
so then I researched it and I basically Googled it. And then I was like, oh, this is interesting. There's obesity medicine and there's a separate board certification for it.
Mm-hmm.
So then I ended up, we didn't have that in India. When I moved to the US, after finishing my residency over here as well, I decided to finish my certification in obesity medicine and kind of learn, what's the data behind obesity, what's the data behind the medications, what's the data behind the lifestyle changes, all of that. That also helped me, kind of motivated me to get into lifestyle medicine.
Mm-hmm.
So lifestyle medicine is, again, like what you were talking about, holistic approach, but not exactly holistic approach. It's kind of like, again, kind of evidence-based in taking care of all the aspects of a person, not just specifically obesity. So
the keyword for today is evidence-based.
It is evidence-based. So anyway, so after all of that, I basically thought to myself, I was like, I did not know as a physician that there's so much of data behind obesity, and there's so many studies that have been done, and they're not new. They've been done for like decades now. So I did not know about this as a physician, and I just kind of wondered, like, what do people know about this then? If I don't know as a physician, having trained in two separate systems, and I still need to kind of go through a certification for obesity medicine. So I'm just wondering, how much do people know about it? And so that's when I started my podcast called Decoding Obesity, because I really try to bring what's the evidence, what's the data behind everything in obesity.
One question I have for you regarding that is, how did you feel during that time? Like, did it affect your mental health? Like when you were obese, like, were you not as confident?
I don't think I was not confident. But I think when I lost my weight, I had more energy. I would say that. I don't think it affected my confidence per se. I mean, yes and no. Yes, when I was like younger, but in my residency, I was already grown up. So.
How old were you? Do you mind?
I was like, I think 28, 29. 30 maybe. I don't know, 28, 29, I think.
So you were my age, 28. Okay.
No, not now.
Oh.
That was back then.
So do you feel like your obesity was due to a chemical imbalance? Like, what is it? Can you share more about that? And I have a question with that as well later.
Well, I think my obesity was because of my unhealthy lifestyle.
Mm-hmm.
And a lot
India
of times
has
it
a
is.
lot of that.
Yes, and a lot of times it is because of the unhealthy lifestyle, which I changed around, which helped me kind of get my weight off. But there's a lot more to it, because I know of a lot of people who have a very healthy lifestyle and they're still having a hard time losing weight.
Yes. So I wanted to ask a question on behalf of my friend, as I was telling you. So, for women and the hormonal imbalances, like, do you know how women can like reset their bodies if they're having trouble losing weight and like they're obese?
Well,
like, do you?
Well, it's for the hormone. I don't know what hormonal resetting would mean, but I know that there are a lot of times that we can do things to help with the problem or help with the disease of obesity. For example, not just healthy lifestyle.
Yeah.
Even in the healthy lifestyle, there are different modalities that you can use. Even we have to work on the causes of obesity essentially, and then on the obesity itself, because there are a lot of things that can cause obesity. For example, if somebody's on some of the medications, they can cause a difficulty in losing weight, and a lot of times people may not realize that. They can cause weight gain. We know that for a fact. If somebody has, say, depression, that is associated with increased risk of obesity. If somebody has, there are other disorders like binge eating disorder, nighttime eating syndrome, they're associated with obesity. There are certain genetic disorders that can lead to obesity. They're very rare, but they can still lead to it. A lot of times we have emotional eating, so that can lead to obesity. So there are a lot of other things that go along with it. There's stress eating.
Guilty.
Hence the term comfort food.
Oh, we
So,
we talked about it today. Me and Courtney, he's on here. That's so funny.
so I think there are a lot of causes of obesity.
Yeah.
What my perception is, and my belief is that lifestyle forms the bedrock. Lifestyle changes form the bedrock of managing obesity, but a lot of times it may not stop there. Sometimes you need more than that. And by what I mean by more is you may need medications, you may need surgery. And that
Yeah.
is just a modality to help you with the disease of obesity. And it's important to understand that obesity is a disease. It's been recognized by the World Health Organization as a disease. It's not a lifestyle choice. So
Wow.
that has to be the first change that occurs in the perception, because a lot of times people feel that it's their fault, it's their lifestyle choices.
Yes. And this makes me realize that, such as mental health is broad and complex, even psychiatrists don't have all the answers. I feel like with obesity, even you may not have all the answers, or just everyone combined, because everyone's bodies are different.
Absolutely.
But do you know if, I know you mentioned that, depression, stress, like those things could be linked to being a factor in obesity. So does that mean then the brain, of course, brain and gut are connected, but is that like for sure that the brain definitely has to do with your obesity as well?
Yes.
Right? Okay.
Yes.
I just want to clarify.
No, there are
Yeah.
neuronal pathways in the brain. So
Mhm.
that fire when you're hungry, but there are hormones that are released by your gut that go to your brain, tell the brain that okay, you're hungry, so you got to look for food. There are pathways that will tell you that we're not hungry anymore, we're done. And sometimes there can be a disruption in these pathways. I'm putting it very simplistically, and that can be because of a multitude of reasons, right? So even the medications that we give work on kind of these pathways to help you understand, because a lot of times, well, not a lot of times, quite, we see this often. People, they just, even if they eat, they don't feel satiated. They're like, we're full, but we still want to eat more. We're not full. I don't feel full. And for me, it's very hard to comprehend what that would feel like, because honestly, if I'm full, I'm full. I know that I'm full.
Yeah.
But a lot of times I hear people say I'm not full. So there are medications that help you, and they start taking the medications and they're like, oh, now I know what feeling full feels like.
Wow. Very
So
serious.
yeah, I mean, it's so that's why I say it's not, a lot of times it is lifestyle, but not always. And even for that lifestyle, there may be other things going on, in the life itself that may cause that lifestyle. For example, somebody's stressed, there's a major issue going on in somebody's life, whether at the job or, in their professional lives, personal lives. That can all bleed into this, and that can all lead to obesity. And then obesity leads to other medical problems.
It's the first time I'm hearing that it is a disease. I didn't perceive it that way. We just hear obesity, oh, someone's obese, or you're about to be obese, like weight wise. Then you're like, oh, let me start going to the gym. But something like where you're really stuck, like because I had some friends, who worked out the gym, but eating healthy, nothing was happening. And then they give up. And it's like they give up so easily. So from my perception, it's like, oh, you didn't work out hard enough. Like you gave up easily. That was my thinking as, a young person. That's not right.
It's interesting that you mentioned that. And I always wonder, this is a question that I ask people. Well, if you think it's all about willpower, why is it that the person does not have the willpower to lose the weight, but has the willpower for everything else in their life?
Wow.
So it's,
Yeah. Wait, so yeah, complete your point there. Like,
no, I was just saying that
yeah,
if it's about willpower,
yeah,
then how is it that that person does not have the willpower
yeah.
to lose
Okay.
the weight, but has the willpower to do everything else in their lives?
Oh, that's
You,
true.
you have very successful people in this world who are suffering from obesity. If they have the willpower to be successful in their, say, professional lives, they're very happy personally. I'm just, I don't know if they're happy or not, but I'm just saying, suppose they are.
Yeah.
They have the willpower to do all of that, but they don't have the willpower to lose their weight.
Oh, yeah, that means it's not them. that they need more help, right?
Yeah.
Yeah. I really like that. I really do. You get that like often asked, like regarding willpower?
I think it's a common perception, and I
Uh-huh.
used to think like that. And after basically reading about it, I realized that that's not always the case.
Mm. So I
It's
want to
not black and
ask
white.
you, yeah. So I want to ask you, being from the South Asian culture, during the time when you were obese, did you encounter any bullying?
Of
Or even
course,
the work you do now, like, do you get comments about it from, our culture or?
no, I not about what I do
Okay.
um, because I think it's important for me to spread this word out there,
Mm-hmm.
and I think people are realizing this, that it's an important thing that they need to understand. But as a kid, when I was suffering from obesity, and I'm always using the word suffering from obesity rather than saying obese, because
Mm-hmm.
I always try to use first person language, because you know it's a disease, so somebody suffers from it. It's not a tag that that
Yes.
person gets, and that's something very important to understand. So there's a association called what is it, OAC, Obesity Action Coalition. They are very strong advocates for patients who are suffering from obesity. I encourage people who have obesity to kind of explore that website. And so basically, yeah. So when I was a kid, I did suffer from obesity, and yes, I did experience a lot of bullying. I did, but it is what it is.
And
I
I
mean,
just want to say, sorry, go ahead.
no, I was just saying that it is, that's
Yeah.
the way the society is. There's a lot of
Yes.
fat shaming in the society.
Yeah.
In fact, that's why I did an episode on what we call weight bias. Recently, I did an episode on that because I think that really exists in the society. That's one of the acceptable things, quote unquote. I mean, I don't think it's acceptable, but that's one of the things that even comedians make jokes about. And
Yes.
so it's very important to understand that that weight bias exists in the society, and it's not the right thing.
I'm smiling because I'm about to tell you something personal. Well, I had two things to say, but I'm about to say, whenever we get rishtas, right? Arranged marriages for me, right? What is his weight? What is her weight? What is her skin like? What is it? The fairness and the weight,
Right.
ladki kaisi dikti hai, those kind of things. And I find that to be very disrespectful and judgmental. What does that matter? Weight, because to me, I always say, oh, weight because I used to be a CrossFitter. So weight can always go up and down. Like that's on me. But what we're talking about here is a disease where I wouldn't have any control over that. So
Right.
imagine a situation like that, especially with some of the Indian movies that have come out, of them where he's carrying his wife. So I don't know. I just feel like I focus more on the South Asian aspect because I feel like more change needs to come there, especially with mental health. That's why like
Right.
I do this. And I was told not to do this, not speak up and things. So what are some of your like family members' reactions that, you have a podcast and like some of the things you want to do? Like, are they supportive?
Yeah, my family's been very supportive. Actually, my
Mm,
brother is a psychiatrist in India, and he has his own YouTube channel. So they've been fairly supportive of what
mhm.
I do, and they kind of respect what I'm doing because they understand the science behind it. Um, I was born in a family of physicians, so so they
Wow.
kind of understand that. Um,
I
so
like
yes, they are supportive, because at the end of the day, I try to stick to evidence-based medicine.
that. Hmm.
I do not want to do anything that is not evidence-based.
Hmm.
And if there is something that I want to do and there's no evidence, I would rather search for the evidence or do something to find the evidence if that is actually going to help or not, than just randomly, say stuff.
Oh, thanks everyone for tuning in. I just want to tell them really quickly because they're happy to have you here. I believe you're the first doctor I've had on my show.
I'm honored to be here.
Seriously, I mean, I'm the future doctor, but you're the doctor now. So someone said, please connect me with this doctor. All right. So, and CL King said hi to you.
Yeah, I say hi to
Okay.
him too.
Yeah.
I was on his show as well.
Yeah. He's really cool. He's
Yeah,
really
he is.
cool.
Very
I
inspiring guy, yeah.
I know we all found each other in the same group. Um, so yeah, I want to ask you, you are evidence based, right? So do you see yourself, growing your own business? Is that where you're heading, having your
I,
own business on the side?
I probably would,
Hmm.
but when I started this podcast, it was a completely a passion project. It wasn't
Oh,
related to
wow.
any business. I didn't have any idea about what I would do, what I wouldn't do.
Mm-hmm.
I really just wanted to get the information out there because I know a lot of people don't have that information. So it started as a passion project. Now, what it ends up being, I don't know yet.
I do.
I don't know yet. The other thing that I've started on the side is kind of life coaching, because I think mindset plays a huge role in all of this. And there is some evidence about the mindset because there are a lot of things, like stress eating, emotional eating, whatever have you. So, psychological help works in that arena. So started doing that a little bit on the side. But I don't know how it's going to play in the long run. I just started doing that, and we'll see how it goes.
Man, you remind me of a mixture of Deepak Chopra and Naveen Jain. You know Naveen Jain, right? From
I
Bio.
don't. No, I don't know Naveen Jain.
He's a billionaire. I gotta show you about him.
I'm glad you're counting me with the billionaires.
Yes. And so his is all about, resetting the body and his vitamins and things like that. And he started at an older age too. And his kids are like, he's maybe, I think 30s, 40s, and he's changing his career. And he's like, what should I do? And his kids are like, you're changing your career again at this age, that kind of comments, in the family. And look at him now. You know what I mean? So I just feel like there's so much more for you. Like you can have the reason why I said, business and you being evidence-based, because I could see you with your own like vitamin, retail product. Because iHerb, HERB, is great for that, where you can supply your own. Like it's a great website where you can create your own and have distribution. So I definitely see that.
We'll see how it goes. I don't know yet.
I know everything. So, yeah. So Parm is she's a psychiatric nurse and well-being coach as well, and she's tuning in. She agrees with your mindset. So thanks for tuning in, Parm. I want to ask you, you said you don't know where you're going with this and you're going with the flow. So when is it that you started decoding obesity?
It was about a year ago, I think in March. And actually what happened was I was contemplating starting a podcast. I started contemplating about it the prior year. So this started in 2020, March, I think. March 2020. And then I was thinking about it since 2019. And I was just putting it off. And I was like, what am I going to talk about? And then in March, I was like, let's just start. There's never a good time to start. Let's just start. So I just started this. And then I was very scared when I started this because I didn't know what I'm going to say. And honestly, in my first few episodes, I don't sound great. I don't like to listen to my own episodes.
Oh, it's okay.
But I mean, the information there is all evidence-based. Like
the message.
Whenever I'm trying to do an episode, I really go through all the data that's out there, and I present like real data, well done studies.
Wow.
That have evidence, not random stuff, not my beliefs, because I believe that it needs to be evidence-based for it to be valid, at least in my opinion. This is not to say that this doesn't have to be individualized to people. Yes, this has to be individualized to people, but I believe in evidence-based options rather than whims.
So I have a question. So I know you believe in evidence-based, but let's say, if today I had an experience regarding obesity that wasn't evidence-based, but I can't explain to you maybe something that's called a miracle. And I follow Sadhguru's teachings, and he says miracles are only things that we cannot comprehend. So
Correct.
You believe in something like that is just unexplainable, because there's a lot of things in this world that are unexplainable but still come to fruition. So what is your thoughts on that?
I mean, like I said, I'm open to these things, but what I say to this is I don't say no, you're wrong.
Yeah.
I say maybe it worked for you, but I don't have the evidence for it.
Yeah.
So if it's working for you, good for you, but I don't have the evidence for it to say that this is a valid way of doing it. Having said that, I'm not discounting the fact that we should not look for the evidence for it because it's worked for you. So maybe that's something we should look at.
I like that. It's a way. It's like you protect yourself that way as well.
Well, it's not about protecting. I think it's about doing the right thing, because I think
Yeah.
I believe in science, so I think there's a methodology to all of this madness.
Yes.
So I believe in that very strongly, and I think whatever we do,
Hmm.
there needs to be. I believe there needs to be evidence, not just for the efficacy, but also for the safety.
I
That's
like
very
that.
important.
I like that also for the safety. You should know well, not everyone knows what they're getting themselves into, but I think that's really important, because we only have one body, right? One mind. We have to protect these things, I feel.
Exactly.
Um, so, so interesting. Mai said, with so many people doing their own research, it's important to distinguish between evidence-based versus based on a few stories. It's kind of like, thanks, Mai, for that. It's kind of like, when people have these theories or all these studies, even I did, in my undergrad, like, critical research theory, all this and that, but we still don't know because that's only based on certain variables. It's not based on
Right.
like a whole population. So I find what you say to be fascinating. But
But
someone asked,
interestingly, you said we have one mind and one body. I think Sadhguru would probably differ
I
on
know
that.
he said we have in his book, Death, we have two souls, one on the bottom of each foot. And that's not SOLES, it's like our soul. And I still have yet to finish reading that. And yeah, he was saying that we have two souls. Did you know that?
No, I've done his, what's his
Inner
course?
engineering.
Yeah,
Me
I've done that.
too.
So I've done that.
It's so great. Yeah.
Yeah. I mean, I find his, whatever he says fairly profound. I think,
Hmm.
I mean, he makes some sense of things if you kind of, depends on how you look at it.
Yeah. You have like your mind is more like doctor. So wait, I have a question now. So do you feel like when people are in their careers and they're thinking, do you feel like they become programmed to think a certain way and it can be difficult for them to like think outside of the box after like years of being a doctor, years of being an engineer, things like that? What are your thoughts?
My thoughts are, I think more than being like that, I think it's scary to think out of the box.
Mm-hmm.
And it's the fear that keeps people doing what they're doing.
See, now you're saying the fear thing I was saying earlier. That's
Well,
so
I mean, look, so like I said, for the medicines,
yeah.
it's not the fear. Well, it depends. If you're okay having a heart attack and dying the next day, that's fine.
No.
Don't take the medications. But if you're
Yeah.
not okay with that, then I say take the medications. The choice, it's a choice, right? Taking
Mm-hmm.
medications or taking anything is a choice.
Mm-hmm.
It really depends on what you want to choose.
I like that. And is your podcast called Decoding Obesity?
Yes, it is.
Okay, that's what it's called, Parm. Awesome. Thank you for your time here today. I hope you enjoyed yourself with my
I'm
humor.
enjoying it.
Do you want to share, before you go, do you want to share some more myths about obesity or some of your things that you found or anything you would like to share? You may. Mm-hmm.
Yeah, I think the biggest thing is that a lot of times people feel like they are responsible for their obesity. Just give me 1 second, please.
It's okay.
It stopped ringing.
I thought
So
it was your
yeah,
phone.
no, I think that's my wife's phone that was ringing. So I think the biggest fear, the biggest myth is that it's a lifestyle choice, which it is not. I would say it's a disease. It's been recognized as a disease. So I think we need to accept it as a disease. The other thing is that while obesity is a disease, not everybody is made the same. So you don't have to lose. Well, the more weight you lose, the better it is. But we usually try to aim, at least in the beginning, and I'm not saying that we stop there, but at least in the beginning, usually we try to aim for a 7 to 10% body weight loss, because you get the biggest bang for your buck with that amount of weight loss. So you don't have to lose like 200 pounds to be at an excellent health, because that may not be attainable, right? So that may not be attainable. So we got to work with what's attainable, what's achievable, and what options you want to explore doing that. So that's the initial goal that we aim for. But of course, the more you lose, the better it is. So thirdly, I would say that a lot of times when people start losing the weight, I'm sure people have experienced this, that they hit a plateau.
Oh,
After a while, they'll just stop losing weight. So it's not that they're not trying. It's the body. It's the body is going to protect the higher weight. So once you reach a plateau, you're going to reach a plateau at some point in time, whether it's after 10 pounds or whether it's after 100 pounds. You're going to reach a plateau where your body's going to be like, no, you're not going to lose more weight. And that's your body doing it. It's not you, not losing the weight. It's not your fault, but your internal chemistry that's causing that to happen. So then we work on that as well. So I think I would leave them with these three.
I like that. But I just realized I'm not going to let you go just now. I have something else to ask you. What do you feel? Okay, so, in our culture, South Asian, the stereotype of, being a doctor and all that. Do you feel that was influenced upon you, or do you feel like this is something you're truly passionate about, or a mix of both,
I think it's hard for me to answer that question because I
Yeah.
come from a family of physicians. So
Oh, yeah.
I saw my parents as physicians, and I think that plays a big role in me
Yeah.
having chosen this as a career path.
Mm-hmm.
But even after becoming a physician, there are so many other avenues that you can explore. And I think what I'm doing now with this thing is really true to my heart. That's what I'm very passionate about, is helping people with obesity and basically with lifestyle changes.
Thank you. Parm has a question. Can you talk about weight gain with menopause and how to control that?
That's an interesting question.
Parm, I have a menopause group for you.
Yeah, there are a lot of changes that the body goes through throughout the life. It's not just menopause. Throughout the life, there are a lot of changes that happen. There are a lot of, like I said, it's not one thing that causes obesity. It can be various things that cause obesity. So it really depends on what's the cause of the obesity. It's not like there's one hormone that's changing and you fix that and the obesity is gone. Sometimes that may be the case, but a lot of times it probably isn't. So there are a lot of other things that come along with it. There are a lot of modalities that we can use now, not just medications. There's surgery, there are endoscopic procedures. There are a lot of things that we can do. And even in the medicines, there are different types of medications that are used for different types of people. Like, something will work for somebody, something will work for somebody else.
Yeah.
There are some medications that we cannot use in some people. There are some medications we do use in some people. Some people have, say, a binge eating disorder or nighttime eating syndrome. We may not need to use medications. We may just need to use cognitive behavioral therapy or coaching to help them. So there are a lot of modalities that we can use, but it really depends on the person.
So, Parm, you need a specialist. Right? It's like you need to see a specialist to figure that
Yes.
out. And that
Well, you
makes
can
it
see so in all
fine.
honesty, even your primary care physician can
Oh,
help you with
wow.
that. But if they're not able to, I would say see an obesity medicine specialist.
Wow. And is that you?
Well, I am working in a hospital setting, so
Wow.
not yet. Not
Wow.
yet.
So wait, so do you have your own private practice, or is that something
No.
you want?
I don't have my private practice yet. But it may happen in the future. I don't know yet.
I know you keep saying that. I think it's so funny. You're just a happy person. You're like, oh, whatever happens, happens. We'll see. Kind of like,
Yeah, I mean, I'm going to take life as it comes. I think
yeah.
one thing that I've realized is that, it's important to have goals, but I think it's also about the journey.
Yeah. Hey, one journey at a time. Try together. I love it. I love what I do. So I want to ask you, and you also mentioned life coaching. So when you do the life coaching, do you know the clientele you want to work with? Like, have you started that yet or not yet?
So I've started coaching people, not just on weight. I'm doing it for everything essentially. I started on this recently because I didn't know, honestly, till last year, or was it earlier this year? I didn't know what coaching is. I was like, what is this coaching? And then I
Life
got
coach.
introduced to, and I was like, life coaching. What is life coaching? Who's a
Yeah.
life coach? I don't need a coach for my life. So then I was like, okay, let's see what this is. And then I got exposed to life coaching as to what it is, what it isn't. And then I got interested in this because I realized that, mindset plays such an important role in almost everything that we do. Everything begins in the mind. It starts here and then it goes anywhere else.
Wow.
And so I got exposed to life coaching, and I was like, okay, I need to get like formal training in this. So I got formal training in life coaching, which is still kind of ongoing, but it's like towards the end.
Is that from a coach who's
Yes, it is.
trained?
So they have, yeah. So even life coaching, there is no official certification. Like you can not have anything and you can call yourself a life coach.
Mm-hmm.
But I'm going through. So there's an international ICF, the International Coaching Federation. That's an international body that kind of has its own certification and its own standards. So I am going. So they have 3 levels: the ACC, PCC, and then the highest is MCC. So I am kind of going through, the hours for my PCC
Wow.
already, and so yeah, I'm working with my mentor, and he has his own training program. So I went through that, which was very, very helpful because that really opened my mind to the power of coaching. I really understood what it can do, not just for me because I experienced it firsthand, but I also people that I've coached, they have found it very helpful. So that's the other thing that I'm very passionate about. So when I'm coaching someone, I lose track of time. I'm just there. So yeah, so that's something that I'm doing on the side as well. But right now I'm not focusing just on weight, but it's like everything. So I've had clients who've had issues with their businesses. They're feeling stuck there. They're not able to move forward. People who've had issues with their weight. People have had difficulty having personal problems, like personal issues in their lives. They don't know what else to do. I don't give solutions. I just coach them, and then
It's like, oh yeah, go ahead.
we just talk.
You said you don't keep track of time. I hope you charge him by the hour. So
Yeah,
Sadhguru also says he doesn't give advice, but it's like wisdom. It's like he says he doesn't give advice, but everything he says, like we take it as advice,
Yeah.
Okay.
Well, I mean, it's a lot of. I enjoy doing it. I find
Yeah.
it very satisfying because when you see the other person having an outcome that they would desire, it's like it's a satisfying feeling that I was able to help someone. It's more than whatever money
Yes.
buys. It's the
Like
satisfaction.
someone said earlier, you're more than just a doctor. That's right. Have you spoken on stages yet? Because I can visualize that as well.
Not yet. That's on the
Okay.
books in the
When
future.
all of this comes to fruition, I want you to cash at me a percentage. Because I can see that. I can see you doing like a TED talk. I can see you, speaking in India, about metabolism and obesity. And I can see all of this. But it's if you see it for yourself too.
That's on the books in the future.
Woo! Awesome.
It hasn't happened yet. It will happen at some point in time.
Kristen said TEDx is coming, Doc. That's so funny. We loved freaking having you here today.
Thank
It
you
was
so
really
much.
awesome.
Yeah.
You
It
were
was
great.
awesome, talking to you as well.
Thank you. Namaste.
This was a lot of fun.
I know, right? I'm so fun.
Who knew we were in the same state?
I know. Never know. So thank you for your time today. Would you like to say anything else? Where can people reach you? At the website?
So yeah, they can actually, I encourage people to listen to my podcast, Decoding Obesity. Really, I really put my heart into whatever I produce, because I really spent time digging through the data to get the real data out. So I would encourage people to listen to my podcast. It's called Decoding Obesity, and my website is decodingobesity.com.
Keep it all the same. You're supposed to, so you don't confuse people. I like that. Thank you so much for your time today. I really do appreciate it because, you're a doctor and also.
Thank you so much.
Thanks. Take care. Bye.
Bye.